I'm not talking about indirect associated expenses, which are also present, but a very conservative number, 30%, are directly attributed to obesity. That's about $300 billion a year for just Medicare, If we were to affect obesity by 10%, which is an incredibly conservative and justifiable assumption that has been borne out in evidence-based dietary experiments and trials, just that alone is $30 billion of reduction of expenses for Medicare rather. That's also obviously correlated with Medicaid reduction in spending. In Medicaid, it's a different opportunity because in Medicaid, we educate children. 53% of children in America are covered by Medicaid or CHIP. And we have programs to teach kids and their parents what to eat, and how to make these dietary guidelines that Secretary Rollins and Secretary Kennedy have crafted with their teams into practice. It will dramatically change the natural history of how children are able to participate in life. But let me give you one last number. If we're able to get the average American, who today retires on average at age 61, get them just to work 1 year longer, because they feel so vital, so strong, so bullish about their future, because they're feeding their bodies nutrients that are essential to their high-functioning productivity, we will increase the overall GDP of our nation by trillions of dollars. So we will reduce healthcare expenses. At the same time, we jazz up the U.S. economy with trillions of dollars created by the productivity of American workers. God bless you both for making the DGA feasible and making it perhaps the wisest investment we could make in our communities. Marty Makary is one of my closest friends, the powerful leader of the FDA who's been taking brave steps along the line and has additional insights.
Thanks. Thank you, Dr. Oz. Today marks the beginning of the end of an era of medical dogma on nutrition. For decades, we've been fed a corrupt food pyramid that has had a myopic focus on demonizing natural, healthy, saturated fats, telling you not to eat eggs and steak, and ignoring a giant blind spot: refined carbohydrates, added sugars, ultra-processed food. This study in JAMA now shows that 60% to 70% of kids are getting their calories from ultra-processed foods. That's an epidemic. We now have a generation of kids addicted to refined carbohydrates, low in protein. They are literally nitrogen negative because we've used old flawed studies that used urine nitrogen to estimate body protein metabolism, and they missed the mark. The old guidelines had such a low protein recommendation that we are increasing that by 50 to 100%. Kids need protein. The old protein guidelines were to prevent starvation and withering away. These new protein guidelines are designed for American kids to thrive, and they're based on science, not on dogma. We have 40% of our kids now with a chronic disease. It is not their fault. This is something that is the result of bad advice from the government and a medical establishment that for decades peddled research from a flawed 1960s model. Today, we are setting the record straight. This is not a willpower problem of our nation's kids. This is something adults have done to kids, and we're going to fix it. And so, as Dr. Oz said, the best way to lower drug prices is for people to stop taking drugs they don't need. We are going to finally address the root causes of our broken healthcare system: insulin resistance and general body inflammation, advanced by the protein-poor, micronutrient-poor, ultra-processed, refined carbohydrate diet that kids are addicted to today. And so, on behalf of the Food and Drug Administration, we are proud to be a part of this. We are grateful to be contributing to this work. Thank you, Secretary Rollins. Thank you, Kyle Diamantis, the best deputy commissioner for food at the FDA the agency has ever had. This is a historic day in America. Thank you, Caroline.
Thank you, Doctor. Thank you so much. Thank you. I hope everyone's inspired to go eat a salad for lunch after this briefing. If anybody has questions on this topic, we will take a few and then we'll get into the topic. We'll start with our new media seat. If you have a question on this topic today, Jamie Franklin, she comes from the Conservator. Why don't you kick us off?
Yeah, first of all, Caroline, congratulations on your pregnancy. We're so excited for you.
Thank you.
Matt moms across the country, including myself, are just so excited by what this administration is doing to make our kids healthy again. But we do have concerns when it comes to these blue states pushing back on a lot of progress that we're making as an administration.